We have pediatrician Dr. Jim Sears here with how to screen your child. Dr. Sears, good morning and thank you for being here.
Thanks, Shelley.
We were talking about some of these numbers yesterday in our meeting, and it was hard to hear these numbers. And I'm sure this is going to be shocking for some parents. 30 years ago, autism was diagnosed in 1 in 10,000 children. So much has changed. What are the numbers today?
Today it's 1 in 68 kids, 1 in 38 boys will be diagnosed with autism. And we think, why is that? There seems to be a combination of genetic and environmental factors.
Okay, so you have today 7 signs to look for. Parents, you want to maybe jot this down in a child about 18 months.
Sure, exactly. We used to think you can't diagnose and treat until age 3.
Okay.
But with newer tools like this, we can figure it out by 18 months, and it's important to start treatment early.
Okay,
so
could you do it any earlier than 18 months?
Sometimes, yeah. You can suspect it earlier. If your child's not talking, no words by 16 months.
Okay.
If they're not smiling by 6 months, even sometimes that can be a sign.
Okay, let's go through the list, Dr. Sears. What is the first thing?
So the first thing, if you point at an object, or does your child point at objects instead of just putting your hand on the object that they want? If you point and your child just kind of looks at you blankly instead of following where you're pointing, that could be a sign.
Okay.
Number 2, does your child respond to their name, or do they just kind of look at you blankly? Okay, and that's a big one.
When you say respond, it's like their eyes kind of light up and they're looking at you like they're listening.
Hey Johnny, hey Johnny. They're like, hi, hi.
Okay.
Number 3, does your child understand how to get something? You ask your child to go get something.
Okay.
Do they know how to do that? And little kids love to go get things. Go get the ball. Or do they just, once again, look at you blankly? That would be a warning sign.
Okay, all right.
Number 4, does your child reach up? If you reach down to pick up your child, do they kind of reach up to you to kind of come meet you, or do they just kind of look at you blankly like, I don't know what you're doing?
Okay, all right.
It's kind of a theme here. Social interactions is one of the themes here. Number 5, right? Does your child play with toys with imagination? Do they zoom the cars around or zoom the airplanes around? Or do they just kind of line them up or stack them up? Okay. That can be a warning sign if they're not using imagination to play.
All right.
And then most kids will, when they look at something, they'll look at it straight ahead, straight on. But kids with autism often will look at you or objects out of the corner of their eye like this. So, and that's very easy to spot.
Yeah.
A lot of parents would just kind of dismiss that. Okay. And then finally, does your child appear lost in a daydream in their own world, or do they interact with you? Good eye contact.
So let's say there's a parent, a mom and dad, who is watching right now, and they say, okay, my child is not doing 2 of these things or 3 of these things. How many on this list that you just went out of these 7 would be alarming or concerning for them that, you know what, we may need to see a doctor or whatnot?
Certainly, the more that you have on the list, even just one of them should raise a concern. And don't, even one, don't dismiss it. Just bring it up to your doctor and ask, my child's doing this, should I be concerned? And then your doctor will kind of go into a more complex screening mode and kind of look at some other things. And if there is a concern, the biggest thing, do not delay. The ability of an 18-month-old brain to heal and to kind of reroute around those neural pathways that are faulty is massively better than a 3 or 4-year-old. So getting that treatment early can be the difference between a child mainstreaming, graduating with their friends and having essentially a normal life versus being institutionalized for the rest of their life.
When you say treatment, what are the treatments available today?
Well, one of the things I'm here to talk about is something called Gemiini, Gemiini.org. So this is video modeling, which teaches, it's something you can do at home. You don't have to wait for the therapist, and it's scientifically proven to work with kids. It helps them learn how to talk. And of course, there's a lot of other therapies. ABA therapy, applied behavior analysis, is one of the most popular, effective therapies. It is expensive and there can be waiting lists. That's one of the reasons why start early. Get it figured out and get those treatments going.
Do you think in our lifetime we're going to sit down at this table and have a conversation that you've or someone has figured out what autism, like what's causing it, and how to keep our kiddos healthy?
I firmly believe someday you'll be talking to the person that won the Nobel Prize.
Really? You do? In our lifetime?
For figuring it out. Yes, I do.
I'm sure there are parents watching right now saying, thank you, Dr. Sears, for coming in, because it's really good to just talk about this stuff and be able to get help. Thank you for being here.